quickly summarize an overview of complementary feeding or weaning. And complementary feeding is a word used when we introduce foods other than milk to the baby, and hopefully the baby is breastfed. In those cases, we continue to breastfeed exclusively till 6 months of age and start complementary feeds at 6 months. There are some situations where you may consider starting the solid foods from 4 months onwards, and this will include cases where the breast milk doesn't seem to be adequate for any reason, and close to 4 months you realize that baby needs some supplement. Instead of bringing in formula milk, you can start pureed food at that stage. If the mother starts to work, and again if she has enough breast milk stored in the freezer and she needs a little support, she can start complementary feeding by 4 months as well. And again, for nutritional reasons, if for any reasons we need additional support, protein intake can be improved with solids, and we can start from 4 to 5 months onwards. If the baby is premature, we go by the normal age, not by the corrected age. So if the baby is born in January and reaches 6 months in June, we start solids in the premature babies as well in June. The progress can be a bit slower compared to term babies in terms of the texture of the foods and so on, but essentially you start at the same time and progress as the baby takes. In majority of the cases, waiting till 6 months is adequate if the growth is good and baby doesn't need additional solids. The main reason is that anything extra coming in the early months is going to increase the risk of infection, and in terms of solids introduced early, you need to take extra precautions as well in view of preventing infection and so on. And you also need to make sure that giving the solids doesn't remove the stimulation for the breast milk, because the breast milk may start dropping after you start giving additional foods. So this is about timing of when to start. Even if there is a family history of allergies, the allergenic foods also can be introduced from the same time of 5 to 6 months in appropriate age appropriate form for the baby. For example, if you want to introduce nuts, even if there is a family history of nut allergy, you can start, and actually introducing early in these cases has been shown to be beneficial in reducing the risk of allergy, as from the LEAP study and other studies as well. So once we start the solid foods, you start in small quantities. Nature of the food can vary depending on the culture, but you always try to bring in variety. Don't change the foods every day. Once you introduce one particular food, you give it for 3 to 4 days, let the baby get used to the taste, and then you change the format. You can start with pureed vegetables because they're relatively bland. There is no added salt needed till 1 year, as I referred to in an earlier video. And if the baby needs additional foods, you progress on to different types of mashed vegetables. Pureed potato is an option as well. If you want to give fruits, give the fresh fruits, don't give fruit juices. Again, I've discussed in a different video, fruit juices are mainly sugar rich, and the fiber and other benefits of fresh fruits, the texture changes are not going to be there. Don't worry about the baby being messy. Experimenting a little bit helps the baby. Bringing in more variety helps the baby. Actually, if you bring in more variety, the baby is less likely to become a picky eater. So if you start giving jarred foods, foods in jar, infant foods in jars, or in a cookie form or something, the baby gets used to the texture and taste. They don't really like to experiment, and that becomes a challenge. These tend to be more sweet as well. So this is a quick review of what foods to start with. In the next video, I'll discuss more on the pattern and how you reduce the milk and so on. Thank you.